care bill now headed to the Senate floor after passing in the Finance Committee. Our political panel breaking it down with how it could affect the middle class next.
We'll eventually give them a chair.
The Baucus health care bill estimated to cost $400 billion in taxes and fees to pay for everything that's in it. So is it really just a tax bill in disguise? Let's talk to our panel this morning. We've got Chris Steyerwalt, political editor for the Washington Examiner. He's here in the big town today. Nice to have you, Chris.
Good to be here.
Bernard Whitman, a Democratic strategist and former advisor to President Clinton. Good morning to you, Bernard.
Good to be here.
And Robert George, editorial writer for the New York Post. He came all the way down from up, what, 10th floor?
9th floor.
Okay.
It was tough.
It was tough.
The traffic was awful.
He came from Washington. And so, Chris, let's start with you. We just had Olympia Snowe on, and she's a Republican, and she was defending her vote to side with the Democrats. But you actually think that this is going to be bad, ultimately, for liberals.
Yeah, it's a weird moment, because right now what's happening is the liberal left and the Democratic Party sort of radicalizing. They want blood. They want to go for a big public option, and they were sort of hoping that the president would have to listen to them. But if there is even a sliver of hope for some bipartisanship or moderate plan, then he doesn't have to listen to them as much, and that's really got them fumed. Sure.
And Bernard, you know, Rockefeller, who's very liberal, he said he voted for it yesterday. I got to have the public option, but at least this keeps it alive. The liberals and the unions hate it. The unions are taking out a whole bunch of great big newspaper ads today saying this thing stinks.
Well, look, I think we have a long way to go before this bill is ultimately passed. But a bill will pass. The American people are sick and tired of not having health care reform. 61% say they'd be very disappointed if we didn't get something, and I think ultimately we will. And the public option is not dead. The thing I cannot understand about the Republicans is, why are they so afraid of competition? The party of free market.
But you want the government to run our health care system?
No, I think that having a public option will help keep the insurance companies honest, keep costs down, and encourage more competition. It's not the government running it. It is the government oversight, which I think we do need some more of.
Because the government is usually so focused and organized when they run anything. Is that the point? And cost effective. What's the competition? What's the competition there?
Yeah.
I think the real problem is that, you know, we talked about it before, that, you know, we're looking at possibly, you know, greater premiums on the average on the average family, the average individual, more taxes, more fees. I think as this process goes on, people are going to be more concerned. They may not even be so concerned that their personal health care will suffer, but they are going to be concerned about how much more money is coming out of their pockets.
Absolutely. Hey, do you have a question for our political panel? Email us right now, friends@foxnews.com, because the debate is far from over. So what is next to get this bill passed or to stall it? The panel will weigh in on that. Meanwhile, the Senate Finance Committee bill is the last of 5 to pass in the Senate, and now it's on to the House and some melding. What's going to happen in the days ahead? Brett Baer up early to explain.
Behind closed doors, the Senate Finance Committee bill will be merged with the Senate Health, Education, Labor, and Pensions Committee bill, which includes a government-run health insurance option. That combined bill will then be voted on by the full Senate. Meantime, on the House side, 3 different House committees' health care reform bills will be combined into one and then voted on by the full House. The House bill and the Senate bill will then head to what's called the Conference Committee, where a select group of lawmakers from the House and the Senate will negotiate and combine the 2 different bills. Again, all behind closed doors. The resulting bill from that Conference Committee must pass the full Senate first and then pass the full House before it is transported to the White House for the president's signature, at which point it becomes law. The bottom line, it has a long way to go. In Washington, Brett Baer, Fox News.
All right, Brett, thank you very much. So we're going to continue the conversation with our political panel right here. Now, behind the scenes, there's going to be a lot of horse trading, but in front of the scenes, the fight is on. The insurance industry is going to say, hey, wait a minute, excuse me, we've been quiet. We've tried not to play the spoilers so far, Mr. George, but they're coming out, and all the oppositions, it's time to come out of the bushes.
Well, they came out with their PricewaterhouseCoopers analysis over the weekend, which does actually show that individual and family premiums are going to skyrocket underneath underneath this. And as we were saying, there's right now it's going to be ugly in terms of going forward when you see this bill added to the other Senate bills. You're going to get the public option thrown in, and Olympia Snowe, in a sense, provides the farthest right that the Senate, I think, is going to go on this. So it's going to be interesting to see what kind of fights happen between Democrats over the public option.
Now, Chris, we just got an email from Randy Cobb down in Tupelo. He says, won't the public option just be a bailout for the unions and their underfunded pensions and health care plans?
Well, look, the organized labor in America is a serious problem with their pension and health funds. They've been in trouble for many years, and they are, as we get more people coming to retirement age, reaching sort of a breaking point. So a great hope of organized labor is that this plan will do something that...
It is a bailout.
Well, those are the words from Tupelo. But, yeah, I mean, I think that's the spirit of what's going on here, is that they need help, and they think this is the most effective way to do it.
And why isn't that correct? I mean, the days of wine and roses for the insurance company are coming to an end. These corporations made money hand over fist for decades, and finally they're realizing that they're going to have to compete, they're going to have to innovate, and they're going to have to really work to control costs, and that's exactly what...
When you said the days of wine and roses are over, I thought you meant for the unions. I mean, everything you just said could also be said for the unions. One of the reasons why
the unions have not been making money by denying coverage to individuals through denial of service, and people have been dying as a result.
Their luxury benefits packages are one of the reasons why they're in a lot of financial straits right now as well. Look at what happened to GM.
Sure, and if you're going to go after insurance, why don't you go after the lawyers with some tort reform? And why can't we buy drugs from Canada?
I absolutely.
I thought the squabbling that we hear over between the unions and between the insurance companies, this all is representative of exactly what the president's going to have to do, because now it's very hands-on for Obama. He is in the mix, and the bill is going to be his. Now it's his war in Afghanistan. Now it's his health care plan. This is President Obama coming into his own, and he's going to have to reconcile labor with insurance.
Which should have been, by the way, from the first place. We would have gotten a better bill
if he can do that. He really deserves the Nobel Peace Prize.
All right, Chris Steyerwalt from the Washington Examiner, Bernard Whitman, and Robert George. We thank you all for a spirited debate on this Wednesday.
You bet. Thanks.
All right.